Hi, I would like to talk to you about a very important form of exercise. That form of exercise is practiced a lot in gyms, in studios. Now it's actually coming into the physical therapy field, and I want to talk to you about, from my expertise, how beneficial this form of exercise, evidence-based, using evidence versus when you talk about it from a spiritual, holistic way. I'm using my expertise as a physical therapist, my reading in researches, in different books, to tell you about how yoga can be beneficial to you and when yoga can be not beneficial and could be posing some harm to your body or can cause some injury or exacerbate some injuries. So without further ado, let's get to it. Okay, so I want to talk a little bit about the background of yoga and where did it come from. It came from Hinduism. It originated 1500 BC. It evolved with different concepts and ideas. It's always been about the same thing, is uniting your spirit and mind together. And in yoga, it's traditional discipline that consists of two things: is a mental and physical, and it's moral and nutritional rules. Okay, and to become a yoga master in a traditional sense, it can take you a lifetime to achieve that, because you have to achieve enlightenment and you have to be able to teach it to other people. So that becomes a very hefty job to get or to do. All right, so in Western culture, yoga is more on a physical side of things, okay? And it's kind of introduced only in 1880, and it's fairly new, and we just kind of experimenting with it. We're trying to understand it, different professions trying to understand it, whether it's personal training or athletic training or physical therapy. We're still kind of introducing it to our patients, to our work settings. So Western model of yoga is actually external. So you're not really trying to internalize and meditate as much. It increases your heart rate expenditure, and it increases your heart expenditure. It increases your muscle tone. It increases the flexibility. And this type of yoga that we practice in studios and gyms is called hatha or hatha yoga. I'm not really sure how you pronounce that, but it's a type of yoga, type of Eastern yoga. So what we practice is not everything about yoga, it's just part of yoga, which is actually we took only the physical part of it. Okay, so in gym, if you ask anyone who practiced or studied exercise science, yoga is considered as weight resistance training. So when you actually twist your body during yoga, you're trying to achieve more elongation. And when you are trying to do anything in longitudinal, like elongate your body, like lifting your arms up, that's more balance. And you combine those together. So you're trying to elongate your spine, you're trying to increase the balance. So this is more from an exercise science perspective. A very important thing about yoga is deep breathing. And deep breathing is actually a form of therapeutic exercise on its own. And combining deep breathing with different positions, when you are sitting or standing, lying down, twisting, lunging, and trying to do deep breathing, that is very, very beneficial for two reasons. You increase your motor learning, because breathing is the first motor movement or the first motor function that we developed when we were born. First thing we do is breathing. So this is the axis of your motor learning. To be able to know a physical skill is to breathe while doing it, so you don't stress your body and you don't stress your brain, and you're able to integrate this movement in your brain function, in your motor function, so to speak. Okay, So deep breathing helps to increase your motor learning. 2, it helps to decrease your stress and trigger your parasympathetic nervous system. If you want to practice an exercise at home that helps to elevate your anxiety and stress, you need to consider yoga, because you actually get a really physical workout and you get relaxation on top of that, and that's very important in order to be able to do other tasks in life. Okay, so how do you know that you are doing good deep breathing during yoga or just as an exercise on its own? So when you do deep breathing, you need to increase your intra-abdominal pressure. What's your intra-abdominal pressure? Meaning that you breathe into your abdomen, you breathe into your stomach, you push your stomach wall out while you breathe, but with one condition, that you don't arch your back too much. So you have to fill your stomach with air, try not to arch your back too much while doing that, and that you are actually doing deep breathing, increasing your intra-abdominal pressure. Okay, second thing is to relax completely and exhale. Or you can do it in a yoga style where you say ha. Okay, so when you breathe in, you have to completely breathe out, and that actually facilitates the next breathing cycle. Okay, so I want to show you that actually in office and in practice we do that. We breathe and we try to integrate this in practice, and in office we try to integrate deep breathing in our therapeutic exercises. And this is not something new. It is something that we have been doing for many years, decades, as physical therapists. Okay, that helps to actually increase your diaphragmatic breathing and increase your diaphragmatic muscle tone. The diaphragm, okay, that separates your abdomen from your chest, it's a muscle actually, and it has a really important function. It's breathing. And when you have bad posture, the diaphragm becomes a postural muscle. It tries to support your spine, and that's actually an abnormal function of the diaphragm. So deep breathing is very important to manage your low back pain and to able to decrease your stress. Okay, so a lot of patients ask me, is yoga good? Can I do yoga for my back pain? And there are two answers for this. The first answer is yes, it is good for your back pain. And the second answer, not all yoga poses are good for you. And I will explain that. How is that actually not good for you? Why yoga is not always good for you? Because of counter posing. Okay? So there is actually a concept of counter posing in yoga. Like when you do downward facing dog, you have upward facing dog. When you do warrior 1 versus warrior 2, or different poses that balances each other out. And what do I mean by that? I mean that when you do downward facing dog 10 times during a yoga session, you have at least to do upward facing dog 10 times, which is not really the case in most of the classes. They tend to emphasize more on bending and flexion of your lower back and spine versus elongation and extension of your back. And that affects your back mechanically and causes a mechanical dysfunction in your back because you move your joints in one direction more than the other. And that actually tends to be or end up to be a bad thing for your back and increases the pain, and it increases if you have a disc herniation, it increases the symptoms. You can feel more radiating pain. A lot of people actually do the child's pose and they say, oh, why do I feel pain in my calves and my leg? Because you are exacerbating your symptoms by just putting your back into one position. And another thing I want to talk about in counter posing, the yoga instructor or the one you see in the gym they don't usually consider that you have back pain. They will tell you, oh, if you have back pain or this during this pose, try to do it that way instead. But they don't consider the fact that you are working in the office, you carry a lot of, maybe carry a lot of things, in your life. You sit in the car. There are so many bending postures that you do already, and you come into the yoga studio in a disadvantaged, mechanical disadvantage in your back. What does that mean? Meaning that you are already in need of stretching backwards. You need to extend your spine more. Okay? So if anything, you should be doing 10 downward facing dogs and 20 upward facing dogs. You should do 20, 30, 40 upward facing dog or cobra positions to balance out all your daily stresses and to counterpose the bending postures that you do during the yoga session. And this is my critic to this kind of practice. And this is my critic to yoga. And I hope you find this helpful. And please, if you like this video, try to give it a thumbs up and follow me on YouTube and Instagram. And I'll see you next time.